This patient came to see me for the treatment of his low back and his neck. In the assessment, when we looked at the spine under load, when he was in extension, that provoked the pain in his back. The pain was also provoked doing the single leg bridge test. His neurological and orthopedic tests were unremarkable. From his assessment, it's clear that the pain in his lower back is coming from the joints of the lumbar spine, also known as the lumbar facet joints, as well as the surrounding muscles that support the low back. His treatment consisted of dry needling into the trigger points around the low back and the neck. Once we had completed the dry needling, we then moved on to trigger point therapy. Now the tools that we use are the rock blades, alternatively manual therapy using an elbow or a thumb. Performed more manual therapy of the muscles that run along parallel with the spine, as well as into the gluteal muscles. Some adjustments started with the cervical spine. We know there was a few joints that were restricted. How's that? Right.
So good.
Also adjusted his thoracic spine as well as his lumbar spine to get movement in the joints that we found weren't moving too well. We then finished off with some myofascial release, working through his pecs as well as subscap under the shoulder.